Very good morning, students. Today we will do the posterior cranial fossa. What are the important questions which examiner used to ask for the posterior cranial fossa? So, if you get the base of the skull or norma basalis interna, and if he is asking you the question on the posterior cranial fossa, the question may be, what is the boundary of the posterior cranial fossa? So begin with the anterior midline structure. That is, you can say that this is the superior border of the dorsum sali, posterior clinoid process. Then it jumps on to the border, superior border of the petrous temporal bone here. Then it goes on to the this squamous part of the occipital bone till the internal occipital protuberance. This is the internal occipital protuberance. So this is the boundary. That is, the groove is here for the transverse sinus, and its upper margin will be the boundary of the posterior cranial fossa. So on either side you can repeat this boundary of the posterior cranial fossa. Then he can ask you a question that which are the bones which forms the posterior cranial fossa, which lies at the floor. Then from the midline again you should start. This is clivus, and clivus is formed, which is a sloping bone. It is formed by the body of the sphenoid and the basal part of the occipital bone, what is called as basi-sphenoid bone. So you can say that this is the sphenoid bone body, and then the basal part of the occipital bone, which forms the bones of the midline. Then on either side of foramina magnum, this is the condylar part of the occipital bone, and posterior, a large area is formed by the squamous part of the occipital bone. But not this. There is one or two more bones which forms the posterior cranial fossa. This is the petrous temporal bone, or petrous part of the temporal bone, whose posterior surface forms also the posterior cranial fossa. Okay, here in the sigmoid fossa, this bone, mastoid bone, okay, the mastoid part of the temporal bone here is also taking part in formation of the posterior cranial fossa, and a little part of this parietal bone. Okay, so this is the postero-inferior angle of this parietal bone, which articulates with the mastoid part of the temporal bone. Okay, that also forms the part of the posterior cranial fossa. So there are many bones which forms the posterior cranial fossa. Then he may ask you, some of you may be asked, which are the midline structure in the posterior cranial fossa? So you can say that it is the posterior surface of the body of the sphenoid, that is here the dorsum sali, and this clivus. Okay, it is the clivus. Okay, this is the basilar part of the occipital bone and the posterior part of the sphenoid bone. These are the midline structure. Okay, then comes the foramina magnum, and then it is the squamous part of the occipital bone which forms the midline structure. This is the internal occipital crest. This is the internal occipital protuberance, from either side of which these are the groove for the transverse sinus. And so these are the structures which will form the midline bony structure. Then the most important question will be asked that what are the foraminas in the posterior cranial fossa? So you begin with this foramina, which is on the posterior surface of the petrous temporal bone, and this foramina is the internal acoustic meatus, through which passes the 7, that is the facial, and the vestibulocochlear nerve, that is the 8th cranial nerve, right? So this is the vestibulocochlear nerve foramina, or the internal acoustic meatus, along with the labyrinthine artery. Then he will ask you another foramina you can show him, which is quite an irregular, elongated foramina. It is called as the jugular foramina, and usually the jugular foramina is divided into 3 parts. From the anterior part will come the inferior petrosal sinus will drain here. From the middle part, the 9th, 10th and 11th cranial nerve will go out, and from the posteriormost part, this sigmoid groove for the sigmoid sinus which open here in the posteriormost, which is the most dilated part of the jugular foramina. So this is second foramina. The third foramina is just inferior and posterior to this jugular tubercle is here, and this foramina is the hypoglossal canal, or the canal for the 12th cranial nerve. Hypoglossal canal for the hypoglossal nerve is there, and ultimately then you come to the foramina magnum, which is the very large foramina in the posterior cranial fossa, placed in the midline, which gives passage to the medulla, lowermost part of the medulla oblongata covered by 3 meninges, as well as the arteries will be passing, will be the vertebral arteries, okay, which are going up, and then the spinal arteries which are going down will be there. Okay, so some of these structures, sometimes the tonsil of the cerebellum can also protrude through this part of the foramina magnum, okay, foramina magnum. So spinal nerve, yes, spinal accessory nerve which are coming from the spinal cord of the cervical region, they are going upward into the cranial cavity. So these are important structures which are there. Then he may ask to describe about the dural venous sinuses in relation to the posterior cranial fossa. You may say that this is the internal occipital crest is the site where confluences of the sinuses are there. That means so many sinus comes and meet here. This will be the superior sagittal sinus, then will be the straight sinus, then right and left transverse sinus, and on to the internal occipital crest there will be a very minute occipital sinus also. And by the side, the right transverse sinus will continue as the right sigmoid sinus, and left transverse sinus will continue as the left sigmoid sinus to open into the jugular foramina. I think this will be the important structures which questions which an examiner can ask about the posterior cranial fossa, and almost I have covered all. Thank you very much for watching this short video on the posterior cranial fossa Viva.